5, Senator.
Okay. Amila, are you with us? Oh, maybe she took us literally 11:20.
U.S. pride.
Hello, Amila.
I am here.
Okay, great. We are too, which is good team. Amila, have you met all of us? I know you know Keisha.
Yes.
I'm Allison Clarkson. I've seen you in Gavard.
Yes. Nice to see you again.
But
Chittenden County.
Michael Sorokin,
Randy Brock.
Yes.
great to see you. Thank you so much.
Nice to see everyone.
Would you be kind enough to introduce yourself for the record, remind us of the refugee agency that you run for us, and talk to us, if you would, about the importance of Section 1, Part B, in terms of the work you're doing and how this would help the refugees coming into the state.
Yes, thank you so much. Good morning. Thank you for the invitation. I'm Amila Mirjanovic. I'm the director at USCRI Vermont, U.S. Committee for Refugees and Immigrants, the field office in Vermont. We are a field office of National Network, U.S. Committee for Refugees and Immigrants. We have been welcoming refugees to Vermont for over 40 years. I have a little PowerPoint presentation, just a couple slides, so you can see some historical data in terms of arrivals. So I will share my screen. If I can get it to work.
If you send it to Scott, maybe Scott is able to.
Oh, here it is. Here it is. Sorry about that. Okay. You can see that now? Okay, great. So I wanted to just show you some historical data in terms of arrivals. Let me just, the reason why I have fiscal year 16 there, that's the last year of the Obama administration, when nationally we welcomed the highest number of refugees in probably over a decade. About 5 people short of 85,000 refugees arrived to the United States during that fiscal year. And in Vermont, we welcomed 386 individuals, which was the second highest number of refugees coming to Vermont in the history of the refugee resettlement program. And then the following year, as soon as the new administration came in, one of their goals was to dismantle refugee resettlement program, and they were very successful in doing so. The policies they implemented at the highest level impacted the program, both in terms of the number of refugees coming to the United States. As you can see, in fiscal year 17, only 32,000 people arrived nationally, and only 236 came to Vermont. And then every year after that, the number of refugees coming to Vermont declined quite drastically. And then in 2020, with the pandemic, we actually only welcomed 23 people to the state. With the new administration, the administration that's friendly to refugees, refugee resettlement, and committed to rebuilding refugee resettlement both globally and also nationally, this year the proposed number of refugees to arrive to the United States is 125,000. And in Vermont, 300,000, oh, I wish it was 300,000. That's half the Vermont's population. We proposed 300 refugees. And then in August, with the crisis in Afghanistan, we we propose to welcome 180 Afghans to Vermont. As of this month, we have welcomed 149 Afghans. The first Afghan arrived to Vermont at the end of October. November through February were probably the busiest months in the history of the program. And I've been a director for 8 years and previously worked at the program for 9 years, started as a case manager. I can tell you that the resettlement of Afghan allies has been nothing we have done before. People were coming at a very fast pace, very close together. And then, we were still in the pandemic. One of the biggest challenges, as you all are aware, was housing, finding temporary and then long-term housing. So I just want to show you the numbers over the years, a little, broken down by country of origin. So for about a decade, we were welcoming Bhutanese refugees from Nepal. That was our major population from about 2007, 2008. And then Congolese, Somalis, and some other smaller groups. And then this year, obviously Afghans, 149. So the first phase of Afghan resettlement came to a close at the end of March. We are expected to welcome about probably 50 to 100 more Afghans, really starting any day. And those people are currently in Qatar, and they are being processed as refugees. The people coming in the first phase arrived as humanitarian parolees, which means that they were granted this temporary stay. It's not even a status. It's a temporary stay for 2 years. Humanitarian parole is a way for our government to process a large number of people when there is a crisis and to bring them to the United States. Afghans were placed at various military bases around the country and then were matched with the resettlement, with resettlement agencies in different states. This is just a reminder that the previous administration's goal was focused on dismantling the protections and prioritizing expulsions. The other major impact of the policies of the previous administration was on funding, federal funding, and which resulted in loss of infrastructure and capacity and loss of staffing. So in 2017, we had 19 full-time staff, and in 2020, we had 12. So we lost case management capacity, employment, and other, valuable staff. We are in the process of rebuilding. As you know, federal funding, the way federal funding works, it doesn't necessarily catch up in a timely manner. And with Afghan resettlement, there have been real challenges in staffing capacity. So we have had to rely on volunteers and part-time support in order to welcome Afghans and make sure that we are meeting their needs. The goal of refugee resettlement is economic self-sufficiency through employment. So all employable adults age 18 to 64 are required to go to work as quickly as possible, soon after arrival, within 90 to 120 days. Most refugees, and as a former refugee, I say this with great pride, most refugees go to work and are eager to go to work as quickly as possible. There's still, people who have, significant health or mental health issues, who may not be able to access the workforce as quickly as possible and may need extra supports, and in some cases for quite a long time. We have over the years had a very strong employment support services. Again, we are rebuilding our team and our capacity. We now have one full-time employment counselor, job developer, who works with newcomers on, developing, getting them ready to enter a workforce. So everything from, working on their resumes to, providing like soft skills orientation, getting them ready to enter workforce. We work with a number of area employers. There's no, as you are well aware, there's no shortage of jobs. Employers are calling us, have been calling us, asking for people. And, as more refugees arrive to the state, I think we will see, more people entering the workforce. However, our biggest challenge remains housing. We have been really lucky with Afghan arrivals. We entered into a partnership with Champlain Housing Trust. They acquired a Town Place Suites hotel in Williston, and they let us use one of the buildings for temporary placement of Afghan families. So I'm happy to let you know that by the end of this month, all Afghans will be in long-term housing. It really has taken, it's taken a miracle in some cases. We have some new landlords who have come forward, small landlords, people who have maybe 1 or 2 units. But it has taken, it's taken a lot of time and effort to ensure that people are in long-term housing before we lose access to Town Place Suites. Hand in hand with employment is English language training. So we provide English instruction. We have teachers who are on call part-time. Since the pandemic, we've been able to offer online classes. We keep adding more levels. We are looking to implement an couple intensive summer classes, particularly for women, and also for, we have a group of about 5 to 6 young people who fall in that age group. They're outside of traditional high school age, but they're not quite ready to pursue secondary education. So we're looking to implement intensive English classes. We're also offering digital literacy. Excuse me?
Happy to stay for a while.
Oh, okay. Financial literacy classes, specific programming for women and children.
Amila,
Yes.
I don't mean to interrupt, but our timing is such that we have another witness that with a fairly big piece of this bill. I think
Okay. I will stop here. This is actually a perfect stop for me.
we would, because we got a sense from Tracy Dolan about how you and Tracy would use this money. And I guess we'd really just love to have you focus on how you would use this $500,000 for training, interpretation, language, all the things that make a successful employee and hopefully a Vermonter who will stay into the future, a long-term Vermont refugee.
Yes. So case management, of course, remains a biggest need, both in terms of, helping people get oriented in the community and helping them learn about our various complex systems. And then employment support, that is a big piece, employment orientation, training, interpretation remains a big piece. You know, that with Afghan resettlement, there was no existing Afghan community in Vermont. So, you know, we were sort of hiring people as they were coming into the state. So they still need support, they need training. Also training of, when I talk about employment, also orientation and support that the employers need. You know, we have a number of longtime employers, but some of these employers, for example, in Washington County, we have some families in Montpelier. We have a number of people in Rutland. Some of these employers are very new to refugee resettlement and working with refugees, working with someone to whom English is not a first language. So being able to provide support to employers, also service providers, both in terms of, you know, orientation to how to work, you know, orientation to refugee resettlement in general, but also how to work with interpreters, and how, you know, the importance of working with professional qualified interpreters who are bound by, you know, ethics and confidentiality. Continuing to, you know, expand resettlement potentially into other areas. For, you know, we're hearing from employers in is St. Albans Franklin County? I'm sorry. Yes, there's a number of employers in that area who, you know, are eager to hire, and some of them have hired refugees, but people are traveling from, you know, Chittenden County. So, you know, one of our goals is to expand resettlement into that area and have people settle there. So that comes with, you know, additional set of, you know, responsibilities on our end. Transportation is
Camila, you've got a question here, because
yes, please.
Tracy teed us up pretty well for this. So
Just wondering, it's been announced that the U.S. Was planning to accept some 100,000 Ukrainian refugees. I wonder if you've gotten any messaging about that, or any plans for that, or any thoughts about that issue.
Yes, so it's not clear how many Ukrainians would come to Vermont. USCRI, our national office, is certainly in conversations with the federal government and other 8 nonprofit organizations who are involved in refugee resettlement. Our hope is that some, you know, would make it to Vermont, but it's just too early to tell at this point. Often what happens, you know, with the first, you know, first arrivals, first group, people will go where they have relatives or friends, or where there are established communities, you know, Ukrainian churches and synagogues. But then a you know, number of people, my hope really is that a number of people would end up coming to Vermont. And we've done this before with other groups, you know, Afghans included, where there really wasn't an established group, but, you know, Vermont has been a welcoming state. We all know that, and we have, you know, the supports, and we're rebuilding our infrastructure. So this funding certainly would, you know, support us in, you know, continuing to strengthen.
Yeah, in significant ways. I think Tracy was really clear on some of the major need areas where, as we look at them in terms of workforce and in terms of training, transportation, language, interpretation, and case management.
Yes,
So,
yeah.
And you and Tracy would be working pretty closely together, I assume. The money goes
Yes,
up granting.
Yes, we work very closly together. Yeah,
Right.
yeah.
Any
Tracy administers some of the federal funding that
Right.
comes to our office, and ALV and ECDC.
Amila, would you be kind enough to send your slides to Scott? Those were
Sure,
great.
absolutely.
Here's a picture. That would be wonderful. And do we have any other questions? Because then we're going to jump into nursing, the big challenge of healthcare workforce. Amila, thank you very much.
Thank you
This was
so
terrific.
much. Really
And if you
appreciate
have
it.
further questions, we'll be in touch.
Sounds good. Thank you so
very
much.
much. Bye-bye.
Bye.
Okay. Jenny.
Welcome. Thank you. I'm here.
Thank you for getting this together.
Thank you, Scott.
It's been like the other Herculean task.
So this is Herculean, because there is, thank you. And Scott has kindly
Oh, thank you, Scott.
gotten us all.
I like the yellow. It's great.
So, Ginny, we have heard all about these nursing programs, each, so we've had a first run through on this, and now Senate Health and Welfare has taken the next editing review of this work, and if you'd be kind enough to fill us in on your work, that would be great.
Well, thank you. For the record, Senator Ginny Lyons, I want to begin by saying that we all hear that we're in a nursing crisis, so we all understand that. And we also have heard that part of that is the high expense of traveling nurses in our hospitals and other facilities. But the nurse workforce shortage is only one aspect of workforce shortages overall. So as we go through the proposal amendment, you will see that our Health and Welfare Committee has made some changes to include other professions within the bill and within the appropriations to increase the number of folks who are in the state, for example, working in dental hygiene or mental health counseling. And you will then also see there are efforts made to keep people working who are currently in particular in our mental health and other counseling services. So we have broadened the scope of workforce professions within the bill. And we have gone through and we've stuck with the money.
Good, thank you.
Very good.
We would like
We
more.
appreciate that. You've got a
But
gold
we could
star.
always use more,
Yeah.
but we understand what we should do, and we did that. So we have moved some of the funds around appropriately based on the understanding that we have for the needs that are out there. This isn't new to us. You know, our committee has worked on this for a number of years and will continue to do that. So as you can see, I will go through as much as I can with you, but to say, and as I said initially, expansion of professions that are covered. We've modified the money where the investments are somewhat based on what we see as the needs and what the long-term benefit will be. And then we've also looked to see which organizations are best fit to appropriate the funds and to run the programs that are included here. So some of them, for example, if it's a loan forgivable loan program, VSAC is an expert in that area.
Right.
If it's a loan repayment program for healthcare, AHEC is the expert in that.
We
area.
had great testimony from
Yeah, well, good. I mean, that's helpful to know. So we had both of them in, and we had a good discussion on that.
Yeah.
And then there are other places where we have delegated authority that seems important for example, there's a place in here where we'll see a linkage between apprenticeship programs that are in our CTEs or in our colleges with employers, and that's something that we've been working on in the past.
Okay.
So just to go through this with you, and I want to say something at the end, because I know you're getting some pressure on EMS, and I know that that's an issue, and
Yes.
I will address that at the end.
Great, good.
So, so the first thing we added was at least a reference to travelers, and traveling nurses. That was not in the bill. So you'll see some things that are added here. The first,
Sorry,
yeah,
I mean, I don't want to split hairs, but I circled this because I just don't think it's the pandemic and workforce shortages that have created an unsustainable reliance on traveling nurses. I think certain hospitals have created this unhealthy reliance on traveling nurses, and there are people leaving the profession to become traveling nurses because
well,
they
that
receive better
it is a federal, just as if all of our workforce issues are federal, a national, that is a national issue. And so it could be resolved at the federal level in putting some cap on payment for traveling nurses. We have talked in our committee about putting a payment cap on traveling nurses so that we could ensure that we have our in-state nurses stay in place. We have talked about incentives for travelers to stay in state, including housing, but they already get housing. But the issue that you raised, sure, that's very important, but the pandemic has exacerbated a number of these things, and this is one very much where nurses have become overworked, or they are seeking pay that's higher. And as I said, if we try to cap the pay in the state, or one hospital tries to cap it, as other states have tried to do, I think Massachusetts is the one that's tried to do that, then we find that, it's spread, the nurses will no longer come. So I'm not gonna argue the point about whether it's a pandemic or something else, but it is a continued workforce issue about traveling nurses, and the pandemic has really blown it out of proportion for us. So I would not change that thought, the language. So, and I do understand where you're coming from on that. We could say it's a federal issue. It's a national.
I think it's undercompensation of full-time nurses rather than a cap on pay.
So
It
can I
could
just-
be even, but even in places in this state where we have high pay, there's
This is
no.
It's not an insignificant conversation.
Yes.
But we have 15 minutes, and I would love for you to be able to go through the entire thing. And we'll work on it afterwards if we want to bring you back, but it's great what you've done here.
Yeah,
You've made it very easy for us, so we want to hear your thinking behind this.
We did. We wanted to ensure that the work that's represented here was reflective of the needs that are out there and the understanding that we could bring to it. So we looked at the first section is on providing incentives for working faculty, and which means that they would, as written, they would get an incentive for over the next 2 years, is $1 million, $500,000 each year, and the faculty who are currently working in the state would get an incentive to help keep them in place. The problem with this one, of course, is that others is it disappears after 2 years. Talk about that. Then the next one is nurse preceptorships, and we've put $1.4 million into that. That a preceptor would be someone who's had some kind of clinical experience in our hospitals, and we've heard that there is insufficient clinical room for folks. So my suggestion is that we add a suggestion to move forward with some creative response through remote access, or using the computer, Zoom, to help folks access clinical and do a combo clinical remote and on hand. So that is that section, and this we've also included the Vermont AHEC in the working group to look at that, because they have so much experience in that area. In section 22, this is an apprenticeship program that I mentioned earlier. The point of distribution through the Vermont State College system to encourage folks into the LPN, everything from the LPN layer, and then up.
This is the this is the upskilling.
Yes. It's both up, it is upscaling, yeah, and but also ensuring that we have folks who are at that LPN level so that they can move right into our long-term care programs and others. The forgivable loan piece, so we separated out in the original bill, forgivable loans and loan repayment were plopped together. So we pulled them apart, and so the forgivable loan incentive program then would rest with the corporation, which is VSAC. So we defined the corporation here as VSAC. And so this would provide for loan forgiveness for students who are studying to get into various, into the profession. And so the language there is consistent with how VSAC would administer those loans. And then it goes on for quite a bit. You can see that. But then the most critical part of this, I think, well, one of the critical parts is each year that the student nurse would receive the loan forgiveness, they would remain in the state, employed in the state. So there's a commitment on the part of the student to become employed and stay in the
And you're on
state.
page 7 now?
I am on page 8,
You're on page 8. Okay.
sorry. Are you saying you wanted me to go fast?
No, that's, I do, but I mean, this is an important part of you.
Yep,
I see demonstrate financial need being
we
struck.
took that out. There really is not, if the goal here is to encourage increased numbers. And we had this discussion in committee, and made a decision that, the need assessment is just not necessary. Or we're getting more people into the pipeline. If DSAC for some reason, DSAC already has its criteria for evaluating applicants, and it could, I mean, they could put need-based in should they desire, but we did not feel need-based was appropriate. You can debate that one. So on what page you want to be on?
8.
So there's page 8, and that is at the bottom of 8, you'll see that for each year of service, they're eligible for loan forgiveness, but they would also be required to provide some service in work in the state. Then on page 9, we have the Vermont Nursing Forgivable Loan Incentive, that's
So, sorry.
continuation.
Okay.
Then on page 9, there is the Vermont Healthcare Professional Loan Repayment. So now we have people who have already graduated and are working. And this is the purview of the Vermont Area Health Education Centers, Vermont APEC, where they have a terrific framework and system for loan repayment for healthcare professionals. So the money.
So is that what you're calling the corporation is AHEC?
No, the corporation is not AHEC, it means AHEC. The corporation in the loan forgiveness program is VSAC.
Is VSAC and
So
loan
VSAC
repayment is AHEC.
and loan repayment, yeah, no, you just gotta, once you get it there.
Yeah, no, I'm
it
there.
fits.
I'm
Yeah,
there.
good. The first time I looked at the bill and I thought, there's something
Right.
confusing here. So we try to make it less confusing.
No, this is great.
So the critical thing that we understand, if you look on page 10, this is the place where we've done some expansion of the professionals eligible for the loan repayment. AHEC currently has a system, and I've worked with AHEC on the loan repayment program and was on their board for a while, so I'm very familiar with what they do and the criteria that they use and the effectiveness of the system. But so our committee looked at what are the professions that we're needing in our state. And we've made a partial list at least, but so we defined it as healthcare professional at the bottom of page 10, including a nurse, physician assistant, dental hygienist, medical technician, primary care provider, child psychiatrist, general surgeon, or in another field experienced healthcare workforce shortage. So it's a it can be quite a long list.
But
And
that's who they serve now, right?
they don't serve all of these now.
No.
No, so we've expanded that.
Okay.
Mostly what they've been doing is, you can ask them again, but primary care, child psychiatrists, PAs, and some APRNs, so there's some advanced practice nurses who have also been served. Then,
Is
Uh,
nurse defined that it's broader than just a RN here?
nurse defined, no.
Broader than RN, is that?
Yeah, well, yes, because they already do APRNs, and this is only included, so there are places where perhaps they'd like to provide loan repayment for a nurse PhD who is going into teaching in nursing school. So the priority at the bottom of page 11, as you can see, is to prioritize awards to candidates working in fields in which Vermont has experienced the greatest healthcare workforce shortages, and AHEC does collect that, have that information. That information is available. You will see on page 12 that we have dedicated $3 million to this. That's like a drop in the bucket, but it is an important incentive for people who are going to stay in our state and work. Then on page.
Can I ask you?
Sure, although I'd really love if you could mark your question. I think if we're just gonna,
I'm happy to come back. If I
Yeah,
can go
right.
through this the first time and I'll come back and I'm happy to answer questions.
okay,
Yeah,
Great.
I
I've
understand.
got a
I know
couple
I'm carrying through it.
okay, no, that's okay, it's good for us to, so
Yeah.
let's tear through and try to.
So on page 12, section 28, there is the nurse faculty forgivable loan. So previously we have the incentive in this first section of the bill for nurse faculty to give them some money while they're teaching to say we value you and please be here. This one is a forgivable loan. So as they, and this is then a VSAC administered program for loan forgiveness for faculty, people who are already in place, retaining forgiveness. And so they have to meet the criteria for the loaner. There's language about how that program would run. I won't go through that. I'm just going to highlight what's here. And page 29A, this is the loan repayment program. This would be administered by AHEC, so it could be a nurse
So
faculty.
we're jumping ahead to
On
page.
page 16,
16.
zipping along.
Yeah, no, it's great.
And this is a $500,000 went to the forgivable loan program, and I believe there's comparable $500,000 for the faculty loan repayment program through AHEC. So it specifically targets nurse faculty, which has been seen as a real driver for an inability to produce nurses out of some of our nursing programs. Then the appropriation is on page 18, $500,000. And then we've added a section because we are very sensitive to the need for mental health professionals. And this is a forgivable loan program. So this is a VSAC administered program for folks who are in the process of becoming mental health professionals. And that goes through the Vermont, with the eligibility would be for folks who are studying in our Vermont State College system, Castleton, or NBU overall. Johnson State has a program, very strong program in mental health counseling. Castleton State has school and other mental health counseling that's so critically important. And then we'll continue with that one over to page 20. That is this is $1.5 million that will go into that program and essentially cut tuition costs for these students who are studying, which is pretty important. Then the next section on page 20, which is 29E, this really adds money into a program that we started last year. I think it was last year. Anyway, that's for our designated and specialized service agencies. So it's a workforce development program to provide incentives for folks who are currently working in our designated agency. So it's a $1.25 million program. This is already a program established, but this adds money into the program to keep our workers there. These are some of the folks who are really very poorly paid and will help maintain them. And then there was a request for a data center, $1 million for the data center. We just felt that that was a little too much. We cut that back to seven.
What page
Oh,
are you on?
I'm sorry, page 23.
23, I see, okay, yeah.
Oh, I'm not a good witness.
You're great. There you go.
Page 23, we put $750,000 in the data center, which I think will be important going forward. And then we haven't added changes to the next section. We can look through that, look through those sections. So the incentive, the Green Mountain Care Board Hospital incentives are still in there. I will say, I would like to share with you, I know that Senator White is very concerned about EMS.
Right, we're having a reading tomorrow.
As we are, and I have looked at the data that she sent. I have the information about the EMS. The Department of Health also has monies for EMS training and education. And I've reached out to them, and I would really suggest that you reach out to them to see where they are, how much money they have, and what their thoughts are. I think we all value, and our committee has taken significant testimony on EMS in the past.
Yeah, as we have it.
Yeah. But what we have here in this bill and for the provisions that are here is like bare bones. There's nothing here that is excess at this point. We have triaged one and stolen from one to give to the other. And we can't rob from Peter or give to Paul anymore. So I am encouraging you not to consider the dollars that are here for the program. That $950,000 out of what we have here is significant. I do encourage you to identify other funds, or at least to hear from the Department of Health about what is accessible and available for EMS training. And I'm doing likewise, because I'd like to know, how we can help these folks.
Yeah, Keisha, you have a question.
I guess like the one thing that I appreciate this presentation, I really appreciate the new sections, particularly. I am still struggling with the large appropriation for preceptor compensation, not because I don't think they deserve to be compensated, but we have what's supposed to be a research hospital, a teaching hospital in UVM Medical, where the nurses have been asking and bargaining for years to be given compensation for doing the education that at a University of Vermont Medical Center. That should, I believe, be happening without us rewarding institutions that aren't doing that, while some hospitals are actually compensating preceptors.
Well, this will provide some funds and maybe start a trend in the hospitals that are not doing it, and then put some pressure for continuation. All I can say is we did not get involved in individual organizational salary or structures. We looked at what the needs are, and I agree with you that providing funding for preceptorship is critically important. But the other thing that we've heard is that there are insufficient clinical resources to provide those programs. And so I think some creative thinking around that is important. When I suggested that maybe Zoom access would work, or medicine would work, there was some light bulbs went on, so we put it in here. But I can't answer your question, Senator. I do agree it would be nice if everyone were treated equally across the state.
Yeah, it would be interesting for us to find out what that expectation is at Dartmouth Hitchcock too. I think we heard that doctors don't get extra pay, that it's assumed as part of their job, and it would help to clarify that.
Well, I've lived with one of those for many years who's never gotten paid for much of the work. It's true.
Yeah.
There's a lot of free care out there.
So I just have a quick question, and then I think it's time to a break. But on page 11, we have these loan, forgivable loans. I think we're in the forgivable loan, or maybe we're in the loan repayment. We're in the loan repayment section. I guess my problem is, yes, they can be residents, but traveling nurses can be residents of Vermont and travel if it's more than 50 miles. They get paid as a traveling nurse within Vermont, which I think is not fair. That's feeding the beast. And feeding the
Where are you exactly?
Page 11
Yeah,
on number 3,
this is a loan repayment through AHEC.
right? And it says simply that they be a resident of Vermont. I would like us not to be funding traveling nurses on this. I don't think
You know,
anywhere.
so I think that,
And I think AHEC said they didn't fund
I
traveling
was just
nurses.
gonna say they don't, and I would think that that would be part of the criteria for the award.
Yeah.
So, yeah.
Yeah, but
absolutely.
I think we
And
should
they
be,
can lose an award if they violate.
I think we should be explicit about
I
that.
think you ask AHEC before you put it in. I just think that they already have very good systemic framework for what they do. I would say, please don't
Yeah.
put it in until, and unless AHEC would say, fine.
And it's true for VSAC too. I mean, it would have to be also loan forgiveness.
Yep.
Okay,
But I wouldn't do it until I talk with the people who are in charge.
right.
We can get down into the weeds on this, but that's not something they would not, as far as they would provide funds for travelers.
Anything else, Brandon?
Any sense on loan reimbursement per individuals for nurses, about what kind of number we are typically
I
talking
think it's
about?
all over the place. I mean, you know, I don't know.
Economics.
Yeah. I do have some data that would support some of the.
I guess just in the back of my mind, I'm just thinking, if I were doing the calculation, if I were a nurse, I would probably calculate the cost of what I would earn as a traveler versus the reimbursement I might earn here.
Exactly.
And it may be
It's
insufficient.
depressing is all get out.
Yeah.
And, you know, for 4 years, I've been trying to think about what could we put in place that would attenuate travelers away. And then all of a sudden, I was at a get together for a college get together, and there's one of my former students who's now a traveling nurse and just so happy. And I said, oh, but it's difficult. And you look at the loans that some of our child psychiatrists are carrying, just unbelievable, and the salaries that they can not make
Right.
in this state, so that they are not covered. So
Well-
it's a huge economic issue. You're sitting here.
Yeah, no, this is the tip of the iceberg. So.
I know.
Well, I think you did a great job
Yeah.
doing this as well as
Thank
explaining it quickly.
So
We
much.
have several other bills we'd like to have you take. and
Yes.
think
I-
you do as
Well, please don't ask me. I did work very hard on this myself. I did try to discriminate. The biggest piece was who's in charge. And so that was my first question.
That's a big question.
And
all the way
I
through
very
our
much
course.
admire the work that AHEC does. So then we had to teach, you know, this is AHEC, this is VSAC,
Right.
and then understanding where we can put some of the funds. Because as it came to us, it was all about nursing, which is laudable, but not comprehensive.
But not the only thing. Well, thank you,
You're
Jenny, we
welcome.
are so grateful. This
Let me know if
advances
you
our
have
work.
questions beside, will you do another bill?
Do you want us to find Senator Lyons in the hall to ask questions? Do we not have time to do?
We
Yeah,
can
I'm
do
glad
that,
to-
or we can have you back.
I'm
next
happy to
week.
come back, whatever
Yeah.
you want to do. And,
Okay, I'm just seeing what the chair
Either way,
feels like.
Yeah,
but if you have a question and it's pertinent information, share it with us.
Okay,
Right, yes.
at least I sit next to Senator Lyons, so I can back her
we
on the
can
floor
talk to the
again.
whole floor.
Okay,
No.
but
It's
if
just
you
little
share,
things.
yeah, if there's anything you think we need to
Yeah,
hear, that would
yeah.
be great.
Right.
Okay,
Okay.
terrific. Jenny, thanks a million.